There are challenges facing a number of West Virginians. The rising cost of prescription drugs forces some to choose between buying their necessary medicines or putting food on the family table. These are the medicines that help people remain healthy, keeping them out of emergency rooms and hospitals. More than 40% of West Virginia's residents aged 19 to 64 are without drug coverage, leaving many West Virginia citizens without access to their medication. Over 90% of medical providers are struggling to connect their patients with prescription drugs. 51% of uninsured adults report that they cut or skip pills to save on costs. Because uninsured people cannot afford their medicine, they are 3 times more likely to die in the hospital than those with insurance. West Virginia Governor Joe Manchin has made West Virginians' health a priority.
I am also pleased to announce the formation of West Virginia Rx. Beginning February the 1st, uninsured working West Virginians will be able to access free prescriptions at West Virginia Health Right. Because of a public-private partnership between my office, West Virginia Health Right, Beckley Health Right, the Benedum Foundation, the Hines Family Charities, the Attorney General's Office, and Healthy West Virginia, doctors, hospitals, and patients will be able to access prescription drugs donated by manufacturers by phone or email via an efficient paperless system.
West Virginia Rx knows not everyone can afford the medicines that they're prescribed.
A lot of people have their own doctors, and what that means is they could go see the doctor for an office visit and they may be able to afford, $40, $50 or a sliding scale fee at the doctor's office, but what ends up happening is they walk out the door with 4 or 5 prescriptions, and either the doctor doesn't have the capacity to hand them samples out of their drug closets, or the patient doesn't speak up and say, I can't afford these. Or some of them don't even know what's written on the prescription, unfortunately. They walk out the door, they go to the pharmacy to get them filled, only to be told that all of their prescriptions cost $400, $500. These are the same people who went to see a doctor on a sliding scale fee. They cannot afford this medicine.
West Virginia Rx helps connect the people of West Virginia with the medications they need when faced with unforeseen circumstances or simply cannot afford them.
I couldn't have taken them. I couldn't have, because I would have had to pay the bills. I owed a house payment, my utilities, so they had to come first. And it's just been a godsend that there's people that will help you get your medicine.
I have gone without medication many a times, because I had to pay my electric bill or I had to, pay rent, gas for the car. I mean, that's, outrageous these days too. So I've gone many times without medication.
Physicians understand that patients may face economic hardships which can have a direct effect on their health and well-being.
People come in with multiple medical problems, and so you have to coordinate that. And if they don't have the money to obtain the medications with that, then that certainly leads to a deterioration in their conditions.
Well, they're really patient, because I'm not a very patient person myself. They're patient with me. I don't know, they're just friendly. I mean, when you walk and meet somebody first time, you get that good impression, bad impression. Well, I've always had good impression when I've came here.
Unexpected changes in a person's prescription drug coverage can create new problems that families have to face. Job loss is just one of these many changes. West Virginia Rx can help.
So we're receiving a lot of calls from people who have lost their jobs, hence lost their benefits. These are the people who are really very proud. They've been taking care of their families for a very long time. They've never had to deal with this before.
West Virginia Rx operates as a result of support from several pharmaceutical manufacturers.
We're proud to join with the Hines Family Philanthropies as part of the prescription drug solution for the uninsured in West Virginia. We're pleased that member companies are participating to help uninsured and financially struggling West Virginians get access to free or nearly free prescription medicines for their good health.
So, what do users of West Virginia RX think about the service?
It means that I have the money to pay my bills and eat and have sometimes maybe the hefty according to what the utilities are, but it's just a big burden off your heart. And I thank God every day for the programs that's out now.
I'd like to thank WVRx for all their support and Governor Manchin for all that he has done. If it wasn't for them, I wouldn't be here today.
For more information, please visit www.wvrx.org or call a representative at 877-388-WVRX. Special recognition for the production of this video goes to the Claude Worthington Benedum Foundation and Heinz Family Philanthropies.